As the sun rose in Kampala on the 17th of March 2026, we were filled with excitement because this was the day for the dissemination of the Active Prevention and Treatment of Maternal Sepsis project. This is a study that has taken place between Malawi and Uganda over the past 3 years, a cluster randomised controlled trial of simple interventions to reduce death from maternal sepsis. As with any event, we started with introductions. It's notable that the teams have come together several times over the years, so in many respects this felt like a reunion, like a celebration. It was great to have the Executive Director of the Infectious Diseases Institute open with some remarks before handing the microphone to the Commissioner for Maternal and Child Health at the Ministry of Health, Dr. Richard Mugahi, who has been an extremely active co-investigator throughout this project and without whom it would not have had the success that it has. And then we had a press conference with several Uganda media houses. This was a great opportunity to really spotlight the impact. A 32% reduction in severe morbidity and mortality from maternal sepsis, the empowerment of midwives, the simple, effective change, and the fact that we were able to actually change behaviours, which is something that is so difficult to do. And it was great to see this picked up by several media houses. Meanwhile, in the auditorium, the teams were working together, sharing experiences, sharing the capacity that's been built, sharing the leadership opportunities that have emerged. And it was great to have some high-level stakeholders in the room who we were also able to interview, such as the WHO, UNFPA and other stakeholders. It was beautiful to see the lessons learned shared between sites. I then stepped aside for a UK press conference, which was relevant because we need more studies in pregnant and breastfeeding women. And then, finally, after all the celebrations and interaction, it was time for a networking lunch, and this is really important. These are senior representatives from hospitals across Uganda, and it was great to actually build those networks and celebrate the fact that we have achieved a cadre of maternal health champions. And you can almost see the excitement in the room now as we exchange jackets so that we can brand ourselves as the APT-Sepsis Maternal Health Champions. I really enjoyed seeing the team members queuing up for photographs with the Commissioner, Richard Mugahi, and a lot of the success of this project has been testament to his dynamic, hands-on visionary leadership and the fact that he's brought together a network of over 1,000 people who dial in for early morning calls for progress on this area. So after all of this celebration, I walked home reflecting on what a wonderful day. It is great to see our work getting visibility and attention because it actually saves lives.